And now to a milestone in the fight against HIV and AIDS. People living with HIV could soon say goodbye to daily ARV use if a trial currently underway in Kenya is successful. 3 centers in Kenya are in the middle of trials to see how effective injectable ARVs are before the same are introduced for HIV management. Brenda Wanga tells us more.
Benta has been living positively for the last 21 years. She's overcome the stigma and discrimination that greeted her diagnosis and is now a HIV activist. Getting to this point, however, has taken her strict commitment to taking her life-saving ARVs without fail.
When I started taking medication, I was taking 9. I was taking like 3 in the morning, 3 in the evening, and I was also taking Septrin. I was also taking another combination of a drug. So the total was 9. Then it's narrowed up to 3 medication per day. And I was taking 1 in the morning and 2 at night. And Septrin was compulsory, you take every day. You can take in the morning and you can also take in the evening, depending on how much your body is. Maybe you are sick, maybe you feel you are not strong enough to face the day. So I've been taking my medication now. It has narrowed up to 1.
Benta admits that taking the pills daily hasn't been easy and opines that some of her peers are failing in their treatment regimes because of this. This is likely to change. Kenya is one of 3 countries in Africa that is participating in a trial that could see injectable ARVs introduced as part of the HIV management regime. Professor Reina Shah is the lead researcher at the Aga Khan University Hospital.
Injectables is a big milestone. It's being used in the US and Europe, and basically what it is, it's an injection that replaces the tablets. This injection is being used in the US and Europe as prescriptions. It's not part of a trial, but these studies haven't been done in Africa. So we with Uganda, Kenya, South Africa, there's a consortium of hospitals and research sites that are doing the study to make sure that these drugs work as effectively as they work elsewhere in the world. So basically we're bringing the trials to Africa so that we can use it on our patients to show that they also work in our patients.
Both sides of your time.
A combination of 2 HIV drugs was approved by the World Health Organization in 2020 to be used as injectable ARVs to be administered once every 2 months.
For antiretrovirals and HIV, the only thing we've had so far is tablets. So this is another treatment option. It's not better than the tablets, but it's another treatment option so that you can take an injection and then not take any tablets for 2 months. So it's a treatment option for people who are busy.
The trial at Aga Khan has already begun, with the first patient getting the injectable ARVs last week. About 40 people will take part in the study at the Aga Khan University Hospital. 2 other centers in Kenya, at the Kenyatta National Hospital and AMPATH in Eldoret, are also participating in the trials that seek to have the injectables introduced in Kenya to aid in improving HIV management.
The injectables, we believe, will improve your adherence. So your outlook, your long-term HIV management becomes very good and very easy.
While that outlook may look promising, the healthcare sector players will have their work cut out for them.
Are able to take 1 drug per day.
Convincing those, like Benta, who use pills to switch to the injections.
Taking me from the drug I've been taking for quite a long time to an injection, I wouldn't be so sure whether it will work the way the drug has worked.
Now, the interim results of this trial should be available in the next 2 years, and if the results are favorable, then the injectable ARVs could be available to the public use in 3 years. Brenda Wanga, Citizen TV, Nairobi.